Ar-Rahman Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. I am Dr. Tarek Haider, consultant cardiology. It's one of my great pleasure to present for my colleagues now this small lecture about the how to take history from cardiovascular patient. I will try to make it little bit simple and easy in a way that any doctor or medical student can take history from cardiovascular patient in easy way and not forget any point in history taking. So for that reason, I divide the history taking into 4 points. I hope that it will be clear here. The first point is the introduction. The second point, information about the present health condition. The third point is information about the previous health condition. Finally, closing and conclusion. I will discuss each point in a separate and detailed way now. About the introduction, first introduce yourself to the patient. So first start by washing your hands and start to wear BBB or personal protection equipment in the appropriate way. After that, introduce yourself to the patient and inform him about your role. So say to him, I am Dr. Muhammad. I am resident here or specialist here in this hospital, or I am a medical student. This is the first point in the introduction, that you introduce yourself to the patient and your role. Then the second point, to confirm the patient name and birth age and birth date. So ask him about his name and his full name, not the first name. For example, your name is Ali Muhammad Abdel Menaim Hassan, for example, or any other name, to be sure about the birth date, so not be confused with other patients with the same name, and this is very common. The next step in the introduction is to explain that you want to take history from him about his health condition. The last point in the introduction, to get his consent that to give you the history. Of course, this is oral consent, no need to be written consent, that please you accept to take the history from you. This will be, should be taken the consent from the patient. After that, we finish the first step in the history taking, which is the introduction. After the introduction, we shall start to collect information about the present health condition of the patient. And this will be consists of certain points. First, the presenting complaint. So start to ask the patient about the presenting complaint. You should ask him what is the complaint that make him let you come to the hospital or to the clinic today. So what is the problem, the medical problem that make you come to the hospital today? Of course, many patients complaining of many things, but what is the main complaint that make you come to the hospital today? This is the presenting complaint, and should be one complaint. And this complaint, when you ask him about the presenting complaint, you should ask him general question, no leading question. What's your medical problem? What the problem that occurred today that make you come to the hospital? General question. Don't ask him leading question. Don't ask him you have chest pain, you have shortness of breath, you have lower limb swelling. Don't give him leading question. Just general question, and let the patient is one to give you his complaint. This is the first point when you get the presenting complaint. The second point, more important thing in the complaint, after you take it as a general question, no leading question, don't use medical terminology. Use the patient own words. For example, the patient is complaining of shortness of breath. When I walk and when I sleep, I have shortness of breath. Don't write dyspnea. Don't write orthopnea. Don't write medical terminology. If he have lower limb swelling, don't like lower limb edema or edema. Just write lower limb swelling. So write the patient own words, don't use medical terminology. So now you take the present history or the complaint or the medical problem that they make the patient come to the hospital this day, and you write it. You gain this complaint by general question. Don't give the patient leading question. Don't use medical terminology. Write the patient own words. After that, go to analyze this presenting complaint, which is history of the presenting complaint. Actually, the presenting complaint, to make it easy, as I wrote here in this paper, which is the next step, is history of the presenting complaint. We should use certain word which make it easy to make the steps and not forget anything, which is Socrates. As we see here, Socrates. Socrates. S-O-C-R-A-T-E-S-S. Each one of these letters will have certain questions to ask about to make the history of the presenting complaint very clear for you and helping in the analysis of the presenting complaint. So now we shall go to this, each letter of this Socrates in details. S means the site of the main symptoms that the patient is suffering from. I will take a very common cardiac complaint, which is chest pain. For example, the patient came to you with the presenting complaint, I have a chest pain. So write the presenting complaint is chest pain. Now go to the history of the presenting complaint, which is Socrates. So S, ask about the site of the pain. Where is this pain? He'll say pain in the area, for example, in the retrosternal area. Then go to the other letter in the Socrates, which is O, which onset. Ask him about the onset of this pain. For example, and this onset is since when and how it starts. So for example, it starts since 2 days and its onset was acute and sudden onset or gradual onset. So for example, the onset of the pain, which is letter O, is 2 days, pain started 2 days ago and it is sudden onset. Then go to the second letter, which is C. What is the character of this pain? For example, the pain, ask the patient, what the character? You should give you character. If the patient is confused, you can give him a leading question in this area. So this pain is compressive, as someone compressing your chest. Is this pain squeezing, as if someone putting his hand on your chest and compress it? Is it burning sensation, as if there is hot water falling on your chest? Is this stepping, as someone stepping your chest? Stitching, as someone stitching your chest? What's the character? You can, if he cannot give you a clear character of the pain, you can give him leading different types of pain and ask him to choose one of them. After this, the C, which is the character of pain, go to the letter R. What is the letter R? The radiation. This pain, you said to me that the pain is retrosternal. Is it localized to the retrosternal only or give some radiation to another area? Sometimes, usually the anginal pain or pain due to cardiac, usually radiating to both sides of chest, mainly the left side and left shoulder, and sometimes left arm, and the inside part of the left arm or the medial side of the left arm, and sometimes to the root of the neck. So ask him if there is any radiation to the complaint that you are suffering or not. This is letter R, or radiation. After R, there is the letter of A. Letter of A means associated symptoms. Is this pain, when this pain occur, is it associated with other symptoms? For example, is it associated of course, ask the patient first. If not, give you or don't understand. Sometimes the patient cannot give you, because of his medical illness, cannot give you full details. You should help him. Is this pain that occur, or this symptom that you are suffering from, when occur, associated with other symptoms, for example, vomiting, nausea, sweating, fever, anything? If there is, you should document this associated symptom that associated with the main complaint. After that, you go to the letter T, which time course. T mean time course. In that course, you said that this pain started since 2 days with acute onset. But during this day, what is the course of these symptoms? Is this chest pain during these 2 days is continuous? It's progressive, increasing, start at a certain degree and increasing during this period, or start severe and regressive, or stationary character, or intermittent. Pain occur intermittent. So you get details about the time course, and if it's intermittent, when it occur for few minutes or 1 hour or more and disappear and return back, and it's occur at twice daily, 3 times daily, once daily. All these details are the time course, or the letter T. After the second letter in Socrates is the E, which means exacerbation and relieving. You ask the patient, you start this pain since 2 days and it is intermittent. So I want to know if there is any exacerbation of this pain or evoking cause of this pain. So this with meals, with effort, with emotion, or anything, ask first the patient. If cannot give you answer, you can give him leading question in this area. This pain occur secondary to effort. This pain occur secondary after meals. This pain occur after emotion, or what is the cause, or occur spontaneously without any provoking cause. And the second part of this question, or letter E, is relieving. This pain occur, for example, after effort. What's relieve this pain? Is this pain is relieved by rest, for example, or relieved spontaneously? For example, if patient come to you complain that I have chest pain, and this pain provoked by effort and relieved, when this occur, I should get rest. After rest for few minutes, this pain relieved. So this will help you in the diagnosis. But if the patient said to you that this pain occur after meals, this is get you to another diagnosis. And if this occur, I can no need to rest, I can do my work. This is also will help you in the diagnosis. Or sometimes the patient said to you that I have a medical treatment and this pain not relieved except some sublingual tablets that was written for me previously. So this will help you in the diagnosis. So the letter E mean exacerbation or relieving, or what provoked the disease and what relieved the disease. After the letter E, we shall go to triple S. As we said, Socrates, the last one is triple S. The first letter of S is severity. You said to me that you are complaining of pain. What degree of this pain? If we can categorize, you ask the patient, or your talk to the patient will be in this way. If we can say that the pain is 10 degrees, from 0 to 10. 0 means no pain, 1 mild pain, 2 is little harder, 3 is more pain, 4 is more, until the grade 10, which is severe pain. There cannot be very severe pain. So if we can categorize your pain, this is a question to your patient. If you want to categorize your pain, you can give it score 3 or 6 or 10 or 1. So give the first S is severity of the pain, and the answer should be given by the patient after you explain him the grades from 0 to 10. The second S in Socrates, triple S at the end of Socrates, is to screen other cardiac symptoms. His main complaint is pain, but he may have another cardiac symptoms that make pain, make him forget the other symptoms, because the pain is the main problem for him. So should ask him, or in other words, screen other cardiac symptoms. Of course, we know the main cardiac symptoms, which are chest pain, dyspnea, palpitation, syncope, and lower limb swelling or edema. So if his main complaint is pain, and you are analyze this pain in good way or completed, you should go to analyze or screening the other cardiac symptoms, which you have shortness of breath, you have syncope, you have lower limb edema, you have palpitation. After that screening, the last S in Socrates is summarize this data to the patient to be sure. So read this data again to the patient, said to him, so to summarize what's your situation, you have chest, I will give example, you have chest pain, which is retrosternal, that started 2 days ago, which is acute, was acute onset, and the character of this pain is compressive in character, and it radiates to your left shoulder and associated with sweating. The time course of this pain is intermittent. It's exacerbated by effort and relieved by rest and sublingual tablet. And the severity of this pain is scored 6/10. There is no shortness of breath, there is no palpitation, there is no syncope, there is no lower limb swelling. So now if you did this thing, you are finishing the present complaint of the patient. The last point in the in number 2, as I said, the number 2 is the information about the present health condition, is presenting complaint, history, details of this presenting complaint, and if the patient is suffering from another problem apart from the cardiovascular system. So you should go to the systemic inquiry. Systemic inquiry, you should ask if there is any medical problem for the patient, he is suffering from it now, apart from the cardiovascular problem. He came with chest pain. If he has another problem, for example, any other system is disease, you should manage also at the same time, because you are managing patient, not managing system or disease or organ. So at that time, you should ask the patient about any systemic symptoms. For example, you have fever, you have loss of weight, you have any fatigability in the last period. You ask about the respiratory symptom. You have cough, you have hemoptysis, you have expectoration. Then go to another system, which, for example, the GIT system. You have vomiting, you have dyspepsia, you have diarrhea. Then go to the genitourinary. You have dysuria, polyuria, oliguria. Sometimes the patient came to you, I have polyuria. This may help you to a certain diagnosis. Maybe the patient is diabetic and you don't know. Sometimes he have cystitis. Oliguria, I feel the patient say, the last few days I feel that I'm giving little amount of urine. Maybe the patient has prostatic enlargement or early stages of renal impairment. Then go to skeletal-muscular system, ask him about if he has trauma. Sometimes he came with you chest pain, and if you didn't ask him about a chest history of trauma in the last period, this may be the cause. Ask him about the dermatology system. Ask him if there is rash in any part of your body, if there is any ulcer in your body. Now we finish the all data about the present health condition of the patient. After that, we shall go to collect information about his previous health condition. Number 3 here, which is try to collect data about his previous health condition. And this is divided into 3 parts as written here. His past history, I hope it's clear. His past history, his drug history, family history, and social history. I'll go in details. When you go to ask about the patient about his past history, you should concentrate about. You are starting with the patient with cardiovascular disease. So you should ask about the past history of risk factor that may cause cardiac disease, for which many things, but 3 are the most important. If the patient has past history of diabetes mellitus, hypertension, and dyslipidemia. So ask the patient, are you diabetic? Are you hypertensive? Are you dyslipidemic? You did any analysis before for this to exclude dyslipidemia, and this was positive and you have dyslipidemia? If these are present, you should know that the patient in a more risk for suffering from cardiovascular disease. The second point, after the risk factor, you exclude or prove that the patient has any of this risk factor for cardiovascular disease, ask the patient about the past history of frank cardiac disease. Do you have any cardiac disease before? For example, patient, yes, I say to you, yes, I am suffering from ischemic heart disease since long period. I am suffering from heart failure and cardiomyopathy from long period. I am suffering from valvular heart disease. I did previous echocardiography and they informed me that I have mitral stenosis, aortic leakage, or anything. So they collect the data about the past history of the previous cardiac disease. The second part of the past history. The third part of the past history, ask him about any surgical problem occurred before. For example, if he did any surgery, cardiac surgery, valve replacement, coronary artery bypass, or any surgery, cholecystectomy, anything, this will help you also in the diagnosis. The last thing in the past history is to ask the patient about his allergy. Are you allergic about anything? Any drug, any food, anything? And if this details of this allergy, if this allergy is just simple itching and rash, or occur as anaphylaxis. When you eat something or certain drug, develop anaphylaxis and severe hypotension and shock and need seek medical request and go to hospital and get fluids and treatment to manage it. So when you start past history, please concentrate on past history of any risk factor for cardiovascular disease, such as diabetes, hypertension, dyslipidemia, any past history of medical cardiac disease, maybe patient known to be ischemic heart disease, known to be valvular heart disease, anything of cardiac disease. The third thing in the past history is you did any surgical procedure before, or you admitted to the hospital for any cause before. You should get details about this past surgical history or past history of hospital admission. And the last thing, you have allergy to anything, so even food or drug or anything, and this allergy is just simple rash and itching or anaphylaxis and become shocked at that time and need medication and seek medication. The second point in getting information about his previous health condition is drug history. You should ask a patient, you are receiving any drug for any problem? And if he's not receiving any drug, just document. But if he's receiving any drug, you should ask him about his drug. You should ask him about this drug. What is the name of the drug? What is the dose? What is the mode of administration? Is it oral or intravenous or topical? For what disease you are receiving this drug? What is the dose of the drug? What the route of administration of this drug? For how long you are receiving this drug? And if you know the details of this drug, you should search for any side effect of this drug. So for example, the patient is receiving, for example, has bronchial asthma and receiving inhalers. Some of these inhalers induce tachycardia. So you should ask him about, you have palpitation at any time. Sometimes the patient is receiving beta blocker for any cause, and this patient came to you with attacks of syncope. Maybe sometimes the patient is coming to you, sometimes the patient is suffering, taking beta blocker and suffering from attack of syncope. This may be the cause of overdosage of the beta blocker, for example. So you should take the past history of drug, what is the name of the drug, what the dose, how you receive it, injection or oral or any way, and you should see if there is, the side effect of this drug. You should ask about the side effect of this drug. This is the past history of the drug. Then go to the family history. About the family history, you should take about details of the family history, but you should concentrate about two most important points. If there is family history of cardiac problem, because as we know, there is certain cardiac diseases that goes in families. For example, dyslipidemia and atherosclerosis, premature atherosclerosis, and familiar dyslipidemia. This occur, and familiar hypercholesterolemia, for example. In this situation, this patient may suffer from premature atherosclerosis and angina at young age. So ask him about any cardiac problem in his family. For example, another thing is cardiomyopathy. Dilated cardiomyopathy and hypertrophic obstructive cardiomyopathy occur in families. So ask the patient about family history of cardiac problems. If it is positive, this can help you in the reach to diagnosis of the patient. The second thing in the family history, ask him about family history of sudden cardiac death or even sudden death, especially in young age. So in family history, concentrate in 2 points. If there is family history of cardiac problems, if there is family history of sudden unexplained death, especially in young age. After the family history, ask the patient about the social history. What is the social history? Social history consists about many points you should ask about. The first thing is his accommodation. Ask the patient about his accommodation. Is he live in a well-prepared accommodation? There is good irrigation, there is good sun enter in his accommodation or not? In the accommodation also, you should ask him about his roommates or the people who live with him, because sometimes one of his roommates or people who live with him suffering from infectious disease, for example, TB or any other disease. This will help you to reach to the diagnosis. About the personal history, about after you ask him about his accommodation, ask him about he's a smoker or not. It's one of the risk factors that if he's a smoker, he's more risky to develop cardiovascular disease. So ask him about he's a smoker or not. And if he is a smoker, you should ask details of smoking. How many cigarettes per day and for how long he's smoking? And usually to evaluate the degree of this smoker is heavy smoker or not, we make a certain method which number of packs of cigarette multiplied by years. For example, he's smoking 1 packet for 1 year. This means packet per 1 year. If he's smoking 1 packet for 10 years. So this patient is 1 packet for 10 years. He's smoking 1 packet for 20 years. So 1 packet for 20 years. He's smoking 2 packets for 5 years. So 2 packets for 5 years. This is the way to evaluate the degree of smoking and how much the patient risk. And we usually consider the patient is heavy smoker when he's smoking 1 packet for 20 years or something equal to that. Yani 1 packet for 20 years or 2 packets for 10 years or 4 packets for 5 years. For example, this is example. So any one of these, 1 packet for 20 years or 4 packet for 5 years is considered heavy smoker and high risky to develop cardiovascular disease. After smoking, in the social history, you should ask him about his alcoholic or not. He's taking alcohol and what type of alcohol and how much and since how long. So he's receiving 1 cup for daily for 1 year or for 5 years, and according to the amount and duration, you can consider him he's heavy alcoholic or not. The other point in the personal history or the social history is ask him about the reactional drugs. Is the patient receiving any reactional drug or is he drug abuser or not? Because some of these drugs has effect on the cardiovascular system. For example, cocaine and amphetamine induce tachycardia, induce hypertension, and induce vasospasm of the peripheral vessels, especially the coronaries. So this patient who's receiving cocaine or amphetamine can come with you with transmetal angina or vasospastic angina. And we saw many young people who came with typical angina and even ECG changes. And if you get the details history, they are taking amphetamine or cocaine. The other drug that can be abused by some patient is the opiate. For example, the opiate has increased the parasympathetic tone and can induce bradycardia, hypotension, and even syncope. The other drug is cannabis. Cannabis in a small dose induce sympathetic overactivity and induce tachycardia. But in high dose of cannabis induce bradycardia and can cause cardiac arrest. If the patient is intravenous drug abuser, put in your mind that this patient may suffer from infective endocarditis, especially in the right side of the heart, which is the tricuspid valve and the pulmonic valve. And this is the main cause. If for any reason you examine patient and you found that he's suffering from infective endocarditis of the right side of the heart, which is the tricuspid valve, directly put in your mind, because this is rare condition except in certain situations, that this patient is receiving too much intravenous injection and maybe he's intravenous drug abuser. Ask the patient he's doing exercise or not. This is part also important in the social history. Is his life is sedentary life? This means he's more risky for cardiovascular disease, or he is doing exercise, so he's little bit immune from cardiovascular disease and hypertension. Ask the patient about his occupation. His occupation is very important. For example, people who's working in high altitude area, they are suffering from hypoxia. They are suffering and this hypoxia are always compensated by polycythemia. So these patients usually have polycythemia. Their blood has high viscosity. Thromboembolism is more common in these people. And at the same time, these people will say to you, when we start our work in this high altitude, we start to suffer from shortness of breath. Although where we are in our accommodation, there is no shortness of breath. This is common because in high altitude there is hypoxia. There is less oxygen in high altitude. Another example for the importance of their work or their occupation. for example, people who's working in mines, for example, they are inhaling too much dust and these things which affect to make problem in their lung, and maybe this is the only cause. Another example to concentrate in their occupation, the people who's working in certain industries that make cardiac medication such as nitrates, during their work 100% there is some nitrate dust evaporate in the air of and they are inhaling it, and the level of nitrate in their blood, although they are not taking this medication, but in their blood it is high. So these people has a certain level of nitrates. When these people go for any reason, for vacation, annual vacation for example, so they are not exposed to nitrates more, at that time the nitrate level in their blood will decrease, and these people commonly suffer from angina pectoris, although their coronaries are normal, but all as much as they are going to their work, going to the factory, they are taking a certain dose of nitrates that compensate for their level, and their body and coronaries equipped with this, adapted with this level of nitrates. So for any reason, if they didn't went to their factory for many days, the nitrate level will decrease and coronary spasm will occur to these people. So the occupation history is very important to take for this patient. You should ask him about the driving license, if he has driving license or not, because this is important. He said, I know I don't have driving license because I have medical problems, so and so and so. So this is also very important. This is the last point in the history, and finally go to the closing and conclusion. So return back to the patient after you finish this and give him summary again for all this data, and you should ask to get concentration about all his symptoms and all these things, and you should ask him if you miss anything in his history, or his complaint. So ask him if anything you are suffering from and I didn't ask about, please give me information. And finally, thank the patient for his time and remove your PPE or personal protection equipment. And this is the last part, and you should sign, of course, this history and put it in the patient file, or you want to present it for any discussion with your colleagues or your professor or anything, you can apply it. Thank you very much.